If you're over 70 and your doctor just scheduled you for a routine screening test, what I'm about to tell you could save your life. Because there are 5 common medical checkups that doctors order automatically at your age. They sound responsible. They sound preventive. They sound like good medicine. But often they are not. They can lead you down a path of procedures, interventions, and complications that may harm you more than help you. And I know this because I see the end of that path. I'm Dr. Traz, an anesthesiologist. For 15 years, I've been managing patients through procedures that come after these screenings, biopsies, surgeries, interventions. And I can tell you from direct experience, many patients over 70 undergo procedures they never should have had. Procedures that started with tests that never should have been ordered. By the time they reach my operating table, the cascade has already begun. And I'm left managing complications that could have been avoided entirely. Today, I'll walk you through 5 specific health screenings that, after age 70, often cause more harm than benefit. These are not rare tests. These are common screenings your doctor might suggest at your next visit. And I'll explain exactly why they can be dangerous, what happens when they find something, and how to have the right conversation with your doctor. Because medicine is built to search, to test, to find problems. But after 70, finding problems often creates bigger ones. And before we go into the 5 screenings, you need to understand one key idea. Screening tests are designed to find disease early, when treatment can extend your life. At 50, this works well. You detect something early, treat it, and gain decades. But at 75 or 80, the equation changes. Now we're often finding slow-growing diseases, conditions that may take 10 or 15 years to cause harm. And statistically, something else is more likely to affect your health before those diseases ever do. But here's the problem. Once something is found, it cannot be unfound. The system pushes forward, more tests, biopsies, treatments, and each step carries risk. Biopsies can cause infection or bleeding. Treatments bring side effects. And after 70, your body doesn't recover the same way it used to. I've seen patients in their 80s undergo anesthesia for biopsies of slow-growing cancers they would have lived with, not died from. But the test started the cascade, and they ended up worse than if nothing had been found. So the real question is not, should we look for problems? The question is, should we look for problems that create more harm when found? For some screenings after 70, the answer is no. Let's start with the first one. Routine colonoscopy after 75. Colonoscopy has been promoted heavily as preventive care, and for younger adults, it absolutely has value. But after 75, the benefit drops sharply. Most guidelines now recommend stopping routine screening somewhere between 75 and 80, depending on your health. Why? Because colon cancer usually develops slowly. Polyps take years to turn into cancer. And if you've had normal screenings before, your risk is already low. But the risks of the procedure increase. The preparation alone, strong laxatives, can cause dehydration, electrolyte imbalance, even hospitalizations in older adults. Then comes the procedure itself. Most colonoscopies require sedation, and anesthesia after 70 carries real risks: confusion, breathing issues, cardiovascular stress. And if a polyp is found, now we move to removal or biopsy, which can lead to bleeding or even perforation. I've seen patients go from a routine screening to emergency surgery because of complications. The test meant to prevent disease became the cause of a life-threatening condition. That's the trade-off most people are never told about. But colonoscopy isn't the only screening that becomes questionable after 70. The next one might surprise you even more. Aggressive cancer screening, specifically breast and prostate cancer tests in older adults. For women, routine mammograms after 75 are no longer universally recommended, especially if there are other health conditions present. Why? because we begin to detect cancers that grow so slowly they may never cause symptoms in your lifetime. But once they are found, they are almost always treated. That means biopsies, surgery, sometimes radiation or chemotherapy. I've seen women in their 80s undergo operations for early-stage breast cancers that were unlikely to ever affect them. The procedures were successful, but the recovery was difficult. Pain, fatigue, loss of independence. And in many cases, the treatment impacted their quality of life more than the cancer ever would have. For men, PSA testing for prostate cancer is even more controversial after 70. Prostate cancer is extremely common with age. In fact, many older men have cancer cells that never grow or cause harm. But PSA testing finds them, and once found, the system moves forward. Biopsies come next, procedures that carry risks like infection, bleeding, and urinary problems. And if cancer is confirmed, treatment options include surgery, radiation, or hormone therapy, each with significant side effects: incontinence, fatigue, and loss of sexual function. Major guidelines now recommend against routine PSA screening in men over 70, because in many cases, the harm outweighs the benefit. This doesn't mean screening is never appropriate. If someone is in excellent health at 72 and expects many more years, it might make sense. But for many older adults, automatic screening is not the right approach. The decision should be personal, not routine. Now let's move to the third screening: routine cardiac stress testing. This is something I see all the time. A patient over 70 with no symptoms goes in for a checkup. The doctor orders a stress test, just to be safe. The result shows a mild abnormality, not a heart attack, not a clear danger, just something uncertain. But now more testing is recommended. That leads to cardiac catheterization, a procedure where a tube is inserted into the blood vessels to examine the heart. And that procedure carries risks: bleeding, stroke, kidney damage, even heart attack. And all of this started from a screening test in someone without symptoms. Then comes the next step. If blockages are found, even moderate ones, discussions begin about stents or bypass surgery. But here's what large studies have shown. In people without symptoms, treating these blockages does not improve lifespan compared to medication and lifestyle changes. So we're exposing patients to risk without clear benefit. All because we found something. That's the pattern. Find, investigate, treat, complicate. And once it starts, it's very hard to stop. That brings us to the fourth screening: routine bone density scans. On the surface, this one makes sense. We want to prevent fractures, especially hip fractures, which can be serious in older adults. So doctors order DEXA scans to check bone density, and if the numbers are low, medications are often prescribed. Drugs like bisphosphonates are commonly used to reduce fracture risk. And yes, they can help, but they also come with side effects: digestive irritation, rare but serious bone complications, jaw problems, especially after dental procedures. And here's the key issue. After 80, especially in people who are frail or less active, fracture risk is not just about bone density. It's about falling, balance issues, muscle weakness, medications that cause dizziness. Those are the real drivers. So treating bone density alone doesn't solve the main problem. And in many cases, preventing a fracture years in the future is less important than maintaining quality of life today. That means focusing on strength, balance, and reducing fall risk, not just adding another medication. Again, this doesn't mean never test or treat. It means don't do it automatically. Now the fifth screening: carotid artery screening. This is an ultrasound test that looks for blockages in the arteries in your neck. The idea is simple: find blockages early and prevent stroke. But in people without symptoms, the data tells a different story. Screening often finds narrowing that isn't causing any problems, But once it's discovered, there is pressure to fix it. That leads to procedures, surgery, or stenting. Both require anesthesia. Both carry risks: stroke during the procedure, heart complications, bleeding, nerve damage. I've seen patients who were completely fine before the screening end up with serious complications afterward, including strokes caused by the very procedure meant to prevent them. Major medical guidelines now recommend against routine carotid screening in people without symptoms, because again, the harm can outweigh the benefit. So now you know the 5 screenings to question after 70. But the bigger question is, why does this keep happening? Why are these tests still ordered so often? There are a few reasons. First, doctors are trained to find and fix problems, not to ignore them. Second, the system is defensive. Doctors worry about missing something and being held responsible, so they order more tests. Third, there are financial incentives. Testing leads to procedures. Procedures generate revenue. And finally, patients expect it. We've been taught that more testing means better care. But after 70, that's not always true. Sometimes more testing creates more problems. So what should you do? Start by asking better questions. When a test is recommended, ask, what are we looking for? What happens if we find something? What are the risks of the next steps? Will this actually improve my life or extend it? Know the guidelines. Most major organizations have age limits for routine screenings. Be aware of them. And most importantly, prioritize your quality of life. After 75 or 80, the goal is not to find every possible issue. It's to stay independent, feel well, and avoid unnecessary procedures. Find a doctor who understands that. And remember, you always have the right to say no. You are in control of your care. I'm telling you this because I see the outcomes. I see patients who were healthy when they entered the system, and worse when they came out. Not because of disease, but because of what was done in the name of finding it. It doesn't have to be this way. Medicine can be more thoughtful, more selective, but that requires informed patients, people who ask questions, people who think critically, people who are willing to say no when something doesn't make sense. So next time a routine test is suggested, pause, ask why, ask what comes next, and make the decision that's right for you. Because after 70, screening is not simple, it's a balance. And sometimes the best decision is to do less.